psychiatry in all of this time doesn't have one case report of one disease validated, not one. What they do is they meet at the American Psychiatric Association. They meet in the DSM committee, Diagnostic Statistical Manual Committee, and they vote on making new behavioral and emotional disorders, and they vote, and then they start immediately calling them diseases. And they tell people, they tell the public these are diseases. Total fraud. Total fraud.
The actual truth about chemical balance is that it's an actual lie. Nobody has yet measured, demonstrated, or created a test to show that somebody has a chemical imbalance in their brain. Period.
What the American public should be thinking about is when they or their loved ones or their friends have received a psychiatric diagnosis, they should be asking the doc, geez, doc, where's the chemical test for that? Where is the objective test for this? And I guarantee you that they'll be told, we don't have a chemical test for that.
There are no biological tests for any mental illnesses that I'm aware of.
There are not current available tests to verify your diagnosis.
There is no test. There is no specific test to differentiate between, let's say, schizophrenia and bipolar disorder. Not a single test.
Yeah, we have not really confirmatory test for the diagnosis.
There is no test, there's no biopsy you can do that says this person is depressed, this person is bipolar.
We don't have anything really currently to identify mental illness per se.
No, there are no specific tests to confirm the diagnosis or show the improvement, like any blood tests or any x-rays or anything like that.
Oh, in my practice I don't do any tests. I just speak with people and listen to them, and then I make a decision in what kind of illness there should be.
We don't really have any specific blood tests or other tests that are definitive for any mental illness whatsoever.
What kind of biological tests do we have available today for detecting mental illnesses?
None.
There is no rational science behind what they think is the cause of these symptoms. The medications that are being given to people are, without exception, introducing chemicals that are altering the brain in ways which can be very damaging. And I'll go a step further and say that in the absence of a proven chemical imbalance for which the medications are, quote, rebalancing or fixing, the medications are in fact toxic.
How many patients have you been able to cure so far?
I would say one.
How many people have I cured? Well, there are no real cures right now in psychiatry.
The idea of you asked me about the issue about how many people I've cured. I don't know that any of us are ever completely cured of anything.
I have not been able to cure many patients.
I have cured none of my patients.
So you have to ask the classic Roman question, legal question, cui bono, who benefits? The people who make the diagnosis.